there can be instances
Right.
where if we were to put these teeth on your teeth, your implants,
Immediately.
on day one, that basically your implants can fail. Hey everybody, it's Dr. Dale Choi from North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center.
Hi, I'm Dr. Jedediah Woldridge.
All right, so we want to create this video because we've been getting a lot of questions about this recently. I even got another YouTube comment about this literally yesterday. Somebody who had an all-on-4 done and was expecting obviously to go home with teeth, right? So the implants placed, expecting to go home with teeth screwed in.
Right.
And was told that they'd be wearing a denture for the next 4 or 5 months.
Yeah.
All right, so what the heck happened?
You know, unfortunately, more than likely, their quality of bone was lacking in density.
Right.
That can be a common reason, and so the consequences of that, as you know, Danny, maybe you could talk a little bit about that from a surgical perspective.
So basically, when we're doing an all-on-4, where maybe you have teeth, we'll take out your teeth, smooth out your bone, place the dental implants, and then we put this prosthesis and we screw it in. See, it's got the little screw access holes underneath, and we screw it into the dental implants, right?
Right.
Well, the multi-unit abutments, but we talk about that in other videos. So the issue, though, is I'm going to try to give you the best analogy, right? Let's say, because when we do surgery, your bone has to heal, right? And so when we place whether a single implant or multiple implants within your jaw, there's a process that goes a few months called osteointegration, where your bone fuses with a dental implant.
Yep.
Okay, it's really cool because this dental implant has tiny microscopic pores.
Right.
It's like pitted.
Yep.
And basically, when you place the dental implant, your blood goes into the tiny little pores, basically over a few months turns into bone.
Yep.
And basically creates a mechanical lock with your bone and the dental implant. Okay, that's osseointegration. This whole concept of placing the dental implant and putting the teeth on the same day.
Yep.
Right, Dr. Paulo Malo,
Right.
Created his loading protocol for all-on-4 back in '98. Everyone thought he was crazy.
Right, they did.
At that time, they thought it was crazy. Yeah, I thought it was crazy too.
Yeah.
But anyways,
Very predictable, and it works really, really well.
It's an awesome protocol.
Yeah.
But there can be instances
Right.
where if we were to put these teeth on your implants
Immediately.
on day one, that basically your implants can fail.
Right.
Right?
And that's the last thing that
we don't want that to happen, right? So the whole objective is all-on-4 is great. Like this whole concept, I mean, when we graduated 2011 from residency, right?
Yeah.
This whole concept, because I don't know about you, but we were doing fixed, but we were doing extractions and then placing the implants,
or sometimes bone grafting.
Yeah, sometimes
waiting
bone grafting,
for
later
that, and then come back put implants.
So it was like a way longer course of treatment.
Right.
So when the all-on-4 protocol was beginning to become popular around that time here in the United States, that everyone thought that the protocol, Dr. Paulo Malo, everyone thought he was crazy, right? But then what was cool about the concept, though, is again, he was a genius, and unfortunately sometimes geniuses are deemed to be crazy early on, right? But he was like, as long as that dental implant has enough stability that we can measure with a little torque meter, or with our torque wrench, and based off of whatever implant system you're using, but if you say around 30-35 newtons of torque, then that implant would be stable enough to basically, for that individual implant, then we would be able to put these teeth on and screw them in
immediately.
Immediately.
Same time that the implant's placed.
So here's the whole fear before is well, if we screw them in and you're biting down and you're chewing on it, that's going to put a certain amount of force on those implants trying to be translated down into your dental implants. And your dental implants, they're not supposed to move during the healing process. It is not acceptable for them to move, right? Yep. So here's why I give this example, right? So hopefully this example makes sense. I never told you this example, but imagine that I have a 10-foot steel post, and I have 4 of them, and I'm going to place them deep in the ground, for to make a patio, right? Now, no matter how far I put this down into the ground, I'm also going to pour some concrete around it, right?
Right.
And it's going to take, let's say this is a special type of concrete that has to set for a month before we can start building on it, right? This crazy contractor comes around and says, you know what, I'm drilling into bedrock. Yeah. This thing ain't moving. Yeah. We're deep enough. It's good. Your rock down here, your soil, everything is nice and stable. We can build on it. There's no micro movement. I promise you, we're not going to mess with the concrete setting. We'll be fine. Because let's say that there was any sort of movement, any sort of tilting, whatever that happens, then the whole patio is shot, right? We then got to start all over, dig them out, place new posts, right? Disaster, right? Long story short, because now the patio that we created, like we built, we wasted all that wood, all the man hour, labor, all that stuff was wasted. Okay. Yeah. So now imagine we have another type of soil where there is not as stable. Right. It creates micro movements. Yeah. Then we'll say we want that concrete to set. Yeah. Give it that solid month. Yeah. Then we can build. Right. And that's literally kind of like what people's bone is like.
Similar, yeah. Right. Especially in that initial stage, because you haven't allowed the 4 months for the biology to take place, and for that bone that's placed, or for the bone around the implant to fuse to it.
Right. So some people genetically have rock solid bone. Like literally, I'm drilling with my placing those dental implants. And I'm like, holy crap! This you're gonna break my burrs, my drills.
Yeah. Very dense.
Yeah, very dense bone. And then you got other people where you're like, oh my god,
very hollow.
No joke, right? Literally, I can take my drill, and let me give you an analogy. If I was to take my little drill and I can just, without even powering up my little drill, my drill burrs are just going through the wall. Right. We got a problem.
Yeah. You know? If you just put it in.
I literally have burrs, drills. Yeah. I can literally push against the bone and it just completely sinks in. Right. Right. And so there's people so everybody is genetically their bone can be different quality. Yeah. There's different factors that come into play. Yeah. Some people sit there and say, "Can I just take vitamin D and calcium pills?" It really, trust me, I placed 10,000 implants in my career. It doesn't make a difference.
And it doesn't speed up the process.
There's metabolic issues that patients may have. There's systemic diseases that patients can have that contribute to bone density. Right. Age differences, all these things. I love getting wisdom teeth out as a teenager versus removing them on a 40, 50-year-old. Right. Completely different experience, right? And so that translates also with dental implants. I get a good idea when I'm actually doing the extractions during the surgery. If those teeth are coming out way too easily, I know that their bone density is low, right? And then place the implants. So long story short, and here's what I'll let you take over, right? So we're looking at about, depending on the implant system, 30 to 35 newton centimeter squared of torque. But there's also been a protocol too where some dentists will say that, hey, if you have a collective, what was it, 150?
Total torque, 120.
120, okay.
Yeah, around that.
So between, let's say you have 4 implants, right? Yeah. And then between all of them together, that you have 120. Right. Then they're saying, hey, so 30 between all of them. But here's my concern. If we have 4 implants, 1, 2, 3, 4, so 4, right? Right. Now, what gets most of the chewing? Your back teeth.
Right.
Right.
They're subject to the most stress. Yes.
Right. Where's the softest bone in the mouth? Maxillary posterior. Yeah. Upper back.
Correct.
Right.
Yeah.
If we're gonna see softer bone, typically it's back here. Yeah. So what we don't want is, if we're talking about 120. Right. You don't want, let me do quickly in the math, 33, 33, 33, or, let's say we're at
10 or
120, right, between 3, right, so 40, 40, 40, and then suddenly we have 5 or 10 back here. Right. And it can happen. It can happen. Because if all the strength is here, and then you're chewing on your back tooth back here, where it had very little stability, that implant's gonna move. Right. Right, and it's gonna probably fail. So what we have to balance as when we do all on 4s is you've done tons of all on 4s. I've done tons of all on 4s. Patients are disappointed if they're not gonna have their teeth. Right. But you're gonna be even more disappointed if implants start failing. Yeah. And then we have to 2-3 months later take all your implants out and then redo the whole surgery all over again. Right, and place more implants, maybe do some bone grafting, maybe do Now here's the beauty of it. What we were just talking about, before we started this procedure, is we've done a lot of all-on-4s, we've done tons of implants. We know certain workarounds, right? Maybe doing a pterygoid implant, right? Because then you don't have to sinus lift.
Creating extra support somewhere to help have that, 120 newtons of total torque, or have a stable implant where you can have the proper support for that full arch of teeth to be able to tolerate some stresses during that period of time that it heals.
Right. And maybe if you had 5 or 6 implants, and maybe if one of your front ones had lower torque, let's say not the ideal 30, maybe at 20, there's a possibility that's going to be fine. Right. Again, it depends on where where it is. Usually, I don't want it to be the last one back here that you have lower torque, right? And the beauty of it again is like if you do have a lower one back here, then we could place a pterygoid. Maybe we'll
can do that. Sometimes you might have to shorten the arch where you don't have the full complement of teeth for that healing period, which is okay because in the end you'll have that full complement of teeth now.
Because what happens if you have a denture after you reduce the bone? Right? So when we do an all-on-4, we got to make space for this prosthesis, and this has to have like around, on average, like 15 millimeters, right, of thickness. So therefore, we have to reduce some bone so your jaw is not off, right? So we have to reduce some of that bone, and if we reduce some of that bone,
a lot of times, the majority of the time, there's a lot of infected bone there. Right. That we have to
get rid of anyways. But what my point though is that if we put that patient in a denture, you're going to have to use denture adhesive, all that good stuff, right? So,
but a lot of this can be anticipated based on our diagnosis from the scan, because the scan tells us quite a bit about the density of the bone that we're going to be placing implants into. And when I see a patient where I look at the scan and I see that it's just all dark when I'm looking at a cross section, that means that it's very hollow. So there's a possibility there that you're going to have to wear a denture after you have your implants placed. But over time, about 4 months later, those implants can integrate into bone that's not as dense.
That's super important point. That's super important. We're not telling patients that because we're not able to put this on the first day, or because your bone isn't dense enough, that you're never getting an all-on-4. Sometimes there's that misunderstanding. Again, I placed tons of implants in my career where the bone is super soft, you don't get enough torque. And then you wait the 4 months, and then you go back later on, and it's rock solid.
And then they can tolerate heavy stresses of the bite. But the chances of most patients going home in a denture are very low. The majority of the time, 9 out of 10 patients that come in and need this treatment done, they'll all go home with fixed teeth.
Totally agree. I'd say
but it is something to bring up because the last thing you want to do is not meet the expectations of the person undergoing this treatment, and you want to ensure though also that they're aware of all the potential outcomes. And I guess the worst case scenario would be that you might have to wear a denture for the time it takes the implants to integrate.
And it's totally worth the wait.
Absolutely, because then you got a set of healthy teeth that can function, that restore your smile, where when you do smile and you speak with other people, you don't have to think about your teeth anymore because you got an attractive smile that works.
Sometimes what we do want, and again, you said it's super rare, right? It's not super rare, but it's rare.
Even less than 9 out of 10. I mean,
I probably have to send somebody at home with an upper, because usually it's always, by the way, it's always an upper issue. Your lower jawbone is always dense enough. I don't think in my career I've ever had to send somebody.
I haven't either.
Right?
I haven't either.
Your lower jawbone is just way more dense. It's like, I tell you, it's like the stud versus the drywall or sheetrock, right? So upper jawbone is just softer genetically with everybody, every single person. And I probably will, like, maybe once every other month, and a patient is gonna have to wear a denture, right? So it's pretty rare, very rare. But there's one other thing too, though. Again, I've placed, including residency, I've been placing implants running on my 15th year now. When doing all-on-4 and trying to get that stability, there is an art to placing dental implants.
Right.
Right? There's an art to how you're drilling. So, and there's a feel. I'm just saying that, like, it's just something that you can only achieve through experience. Right?
Absolutely. Yeah.
So there is that added aspect that if you do, want to have teeth the next day, it is better off going to somebody who's done a lot of all-on-4.
That, and I would also say a surgeon who has lots of knowledge, lots of years experience, placing dental implants and restoring patients with a total replacement type of surgical approach.
Right. I mean,
it's really critical. If you want predictability and you want long-term success, it's very critical to go to the person who is doing that on a daily basis.
Right. All-on-4 is very different, and I will venture and say that it doesn't matter if I've been placing implants for 25 years.
Right.
All-on-4 is a different beast.
Yeah.
And so, having that experience in how I drill, and still, I try to be, I know you're a perfectionist. I'm a people pleaser.
Yeah.
I want to give people great results. So literally, even though I've placed so many dang implants in my life, it's still, all-on-4s can still be a little bit stressful on the maxilla,
right.
upper jaw, because you want to get that density of bone, and then so the way that you're drilling, and there's so many little nuances that come into play. But just want to let patients know about, basically, I literally have seen that comment probably happen, pop up 3 times in my comment section on YouTube videos in the last 2 weeks, because people are wondering, they went to get their all-on-4 done and they're going home with a denture and being told that they're gonna have to wear a denture for months. And I had a patient text me yesterday saying that she lost confidence in her implant surgeon because he never told her that could happen. So
there you go. I mean, it's about meeting expectations and fully informing your patient or whoever comes to you for a consultation, and when you're evaluating the CT scan, because that's the gold standard of diagnostic measure to be able to determine is this person a good candidate for dental implants, and what potential obstacles can you foresee based on the quality of their bone and the volume of their bone, right? Do they have the volume? Is the quality there? Is there some infections that might get in the way from you being able to place these implants correctly? And what's the potential outcome associated with some of the issues that you might foresee?
Could we talk about one last thing?
Yeah.
All right. Have you seen surgeons or people tell patients that you're better off just not loading the prosthesis up top because there's going to be less issues, right? I've seen that, right? And it's still a safe way to go, don't get me wrong, but do you feel that those patients still would have been fine in the long run and had their teeth loaded without having been so overly conservative?
I've heard more of that, but in my career, I've worked with a lot of experienced surgeons and things. So,
so from your last place of work, you had the benefit of working with experienced surgeons.
Unfortunately for you and I, we've worked in scenarios where we're always working with doctor partnering people with people who know what they're doing.
Yeah.
But I've heard about it.
Yeah. And I personally have seen it. I have seen it, and I'm also seeing comments about it.
Right.
So,
that's
not trying to throw anybody on the bus, but basically what's happening is nobody wants complications.
Yeah.
Right.
And the beauty of full arch, fixed implant, supported types of situations, it's a very, very predictable treatment for patients that are facing situations where their teeth are failing, or situations where they have no teeth. It's a very predictable treatment when performed correctly, to get patients to a place where their smile is restored and they have their appearance intact, they have a set of teeth that are functional, set of teeth that are comfortable and a set of teeth that they can keep clean for many years to come, so that they can protect the work that's been done.
Right.
And you know, that's what you and I are able to provide our patients with. You know, and also when we see that there's some situations with the scans, the 3D scans that we take on our patients, where the bone quality might not be enough, or the volume of the bone might not be enough, or there might be some infections that have caused a lot of deterioration in the bone to potentially have us, or potentially make things more complicated when trying to execute this treatment, that will give you all of the information that you need to know in terms of what is going to be required to get you from that place that you're in to a place that you want to be.
Right. So predictability is a huge thing for us, right?
Yeah.
So predictably, and again, we've done this tons of times, but predictably pushing the envelope a little bit, not being ridiculously overly conservative, where we're going to do this over a 1.5 year treatment.
Right.
That's what we used to do back in the day. I know that sounds crazy.
In residency, yeah.
Yeah, I know that sounds crazy, but that's what we used to do.
It's not necessary anymore.
Yeah, not necessary anymore. As long as you know what you're doing.
Right.
Right?
Yep.
And then also setting expectations.
Yeah.
So just wanted to let you know, this is what's actually going on when you're wondering why you're wearing a denture for 4 months. Some of these dentists, and they weren't patients were being told. So hopefully, and if you haven't had all on 4 done, hopefully this will help you understand a big aspect of it, and maybe you can even ask your questions, to your surgeon or whoever doing all on 4 on you.
Yeah.
Okay, so if you guys found this information helpful, please feel free to give us a like or follow. We're gonna always try to put out really informative, helpful content out there for you guys. We love doing this. This is fun. It's a big passion of ours. Kind of nerds about it, but no, this is really what gives us the joy and satisfaction of what we do. But also, if you have any questions about any other topics, please feel free to leave a comment below, and we actually do read our comments, and we'd love to help people out with that. So we will see you next time. Thank you so much.
Sounds good. Thanks, Danny.